So IPREP started for University in Indianapolis, Post-Baccalaureate Research Enhancement Program. The program has been funded through NIH. For now, we're on the 12th year on the program. It has been extremely successful. The goal of the program is to recruit underrepresented minorities, also to recruit people from underserved backgrounds, to make them more competitive to Ph.D. programs in biomedical sciences. So when the program originated, the program started with 5 target programs for biomedical research. It started with addiction neuroscience, medical neuroscience, clinical psychology, biomedical engineering, and human performance and kinesiology. Over the year, we have expanded our field. Now we do basic medical sciences programs, including immunology, anatomy and cell biology, and other programs across Indiana University in Indianapolis. The main goal of the program is to, again, we take students from underserved backgrounds that maybe have a very good academic background, but they were never exposed to good research or the research experiences that you expect of somebody to get into a PhD program. And the program, basically what it does is take those students, or we call them fellows, they come to Indiana University, and we do professional development for them. We'll help them submit applications to PhD programs, coaching, mentoring. We spend a lot of time mentoring them. What are the best choices for their careers? And then also we spend about 75% of the time in research lab, getting those necessary lab skills, those experiences. Many of them end up with publications, presentations, so that makes them a lot more competitive to PhD programs in the biomedical science across the United States. So one of the things that we pride ourselves here in Indiana University is our program have worked together for, again, 12 years now in the process with a group of faculty that are very involved in mentoring. My co-PI of the program, Dr. Randall Hopper, he's the director of the Graduate Mentoring Center. We make sure that the mentors that participate in the program have the required training to be good mentors and to prepare those students to biomedical research careers. In addition, they need to be aware of culture and ethnics type of things. So when they're working with students from the represented underserved populations, they can really address the unique problems for those populations. I mean, our program has been extremely successful. Again, we're in the 12th year now. We have kind of graduated 53 fellows, ballpark, and we have an about 87% rate of students getting accepted into a PhD programs in biomedical sciences. Again, you got many students that come in that from universities that mentoring was not maybe available, or they were not part of a cohort of students. So many times they don't understand what is required to do a PhD. A lot of the students that apply for a program are for first generation, so their parents have never been in college. So trying to get a student to understand what does it take to get a PhD when you don't have the mentoring from the house, from the parents, or you don't have the mentoring from the universities they're coming from. I mean, it's crucial for them to understand, okay, this is what it takes to be a PhD. In one case, we have one of our fellows has an MD PhD. He finishes an MD PhD, which is very, very hard to get into an MD PhD program, very unique. But mentoring is so crucial with the fellows. So our mentors in the IPREP program are selected. They go through training programs. For culture enhancement. They participate in the National Research Mentor Network. So we try to prepare our mentors to give those students the best experience possible. In addition, our IPREP program has been around for 12 years. We are working with a cohort of faculty and members of the university that not only provide academic mentoring, they provide social mentoring, they provide financial mentoring, They have a whole series, so it's not only one mentor serving one student. We have a team of mentors working with the students to make it as much successful as possible when they go into a PhD program. So IPREP is so important at Indianapolis because number one, it prepares our next generation of scientists. I mean, like I said before, we've been very successful with almost an 87% rate of acceptance into PhD programs. About 20% of those students have stayed in Indiana University. So they're basically are in the School of Sciences, in the School of Medicine, in the School of Health and Human Sciences. So we bring people from other states, we bring people from Indiana, prepares them to get into PhDs, and we take them into our PhD programs.